Hey, this is K1906. Today we're going to talk about stop the bleed. When it comes to stop the bleed, do you really know how to stop the bleed and how to or when to apply a tourniquet or how to pack a wound or something of that nature? If not, this one's an excellent slide for you. So here we go. It's going to be Stop the Bleed. If you notice when it comes to this is a national push, stopthebleed.org. As you can see, these are all of the members that are actually supporting Stop the Bleed. For the American College of Surgeons Committee on Trauma, the American College of Emergency Physicians, the National Association of EMT, or we'll call it Emergency Medical Technicians, and also the Committee on Tactical Combat Casualty Care. Now, for the military, they call it TCCC. However, for the civilian version, we call it TECC. So instead of tactical combat, it's called Tactical Emergency Casualty Care. So for the civilian side, it's TECC and not TCCC. Now, some of these images will be disturbing, so be mindful of that when watching these. Some of the images may be disturbing to others, but honestly, if you're in Stop the Bleed, you're going to have to toughen up when it comes to it, to be honest with you. The number one cause of preventable death after the injury is bleeding. So basically, if we're injured and they're bleeding, how can you plug that hole? I mean, that's the straight to the point way of saying it. How can you stop that bleed? How can you plug that hole? If there's a hole or opening somewhere, they're bleeding. How do you stop that bleeding? So that's what we have to focus on. Where can I use this training? So if you take a look, where exactly can you use this training? You can use it at home. You can use it in school. If there's a shooting, you can use it in a shooting, bad weather, in a car, and at work. So these are all the places, so basically everywhere you go, Walmart, grocery store, anything of that nature, you can use it anywhere. So it's important to know and understand stuff. For the goals of this, number one, identify, recognize life-threatening bleeding. Now, if it's a scratch or a cut, a Band-Aid would do, but that's not considered life-threatening. So you have to recognize the life-threatening bleeding. And then number two, stop the bleed. You have to take the steps to actually stop the bleeding: pressure, packing, and tourniquet. And these are the three things that we're going to actually talk about today. Personal safety. I said this in one of my previous lectures. When it comes to personal safety, you're talking about being safe. You have to be safe first, because if you're injured trying to save somebody else, then it defeats the purpose. So you only want one patient, not two. So your safety is your first priority. If you're injured, you can't help others. Like stated before, help others only when the scene is safe. If the situation changes or becomes unsafe, first, stop. Look around, see what's going on. Two, move to safety. And three, if you can't, take the victim with you. Also, wear gloves. What we talked about earlier, PPEs, personal protective equipment. So your gloves, you want there to be a barrier between your skin and the blood. Again, you don't know what they have. If they have any type of STDs, HIV, anything of that nature, any type of disease, you want to have a barrier so that doesn't contaminate you. If you get blood on you, be sure to clean any part of your body that the blood has touched. Also, tell a healthcare provider that you got blood on you and follow his or her directions. Now, when it comes to the ABCs of bleeding control, letter A, alert 911. So call 911. B, bleeding. Where are they bleeding from? Can you stop it? And then C, compress. Is it direct pressure? If we have direct pressure, can we stop that bleeding? Alert, dial 911. You see it, dial 911 first. Call 911. Know your location, because that's going to be the biggest thing. I know our cell phones now have GPS, and 911 can actually triangulate where we're located. But please know where you're located. Don't say, oh, I'm on the highway northbound. On the highway northbound where? What highway are you on? Are you on 85, 75, 10, 20? What highway are you on? Is there a mile marker or exit near you? By giving them more concise directions or locations, it's easier for them to identify where you are and get to you. Also, follow instructions provided by the 911 operator. If you notice in the diagram, she has bleeding here, she has bleeding here. Now, something like this, we know it's a cut, is not squirting out. So does something like this actually require a tourniquet? Maybe not, but we have to figure out how bad that bleeding is. Find a source of the bleeding. Look for continuous bleeding. Is it venous blood, which is more the oozing, or is it arterial, more the squirting? Is it large volume bleeding and a pooling of blood? So again, make sure you know what type of bleeding it is.
There may be multiple places the victim is bleeding. So just because you see one place doesn't mean there are not other places. So make sure you're able to identify all the different areas where they're bleeding or where that bleeding has come from. Also notice clothing may hide that life-threatening bleeding. So where we said earlier, when it came to CPR, modesty is out the window. You have to remove clothing and identify where the bleeding has come from, especially if it's life-threatening. Now for the bleeding, is it on the arms? Is it on the legs? Is it in the neck, armpits, or the groin? Or where on the body exactly is it? Now, if you take a look, these are called your extremities, your arms and legs are your extremity. For something like this, you can use a tourniquet, which we're going to talk about later. Your groins, your neck, your armpits, and your groins. So these are other areas as well. Now, with these areas, you can't use a tourniquet. So be mindful of that. And basically the general body, center mass. Where's the bleeding come from? We have to be able to identify where that bleeding is coming from. The letter C is compress, direct pressure. So we have to apply direct pressure to try to stop that bleeding. Apply direct pressure to the wound. Focus on the location of the bleeding. Use just enough gauze or cloth to cover the injury. Again, you don't want like a 30-foot roll of gauze, try to stop bleeding. Use just enough, because too much is bad. And when they say never too much, yeah, too much is bad. So you want to use just enough. If pressure stops the bleeding, keep pressure on the wound until advanced medical help arrives. Compress or packing. That's what she was doing. She was actually compressing. For large wounds, superficial pressure is not effective. Again, for large wounds, superficial pressure is not effective. If bleeding is from a deep wound, pack the gauze tightly into the wound until it stops bleeding. Hold pressure until help arrives. So if you notice, letter A is what we're talking about. Notice there is a large wound. So what they're doing is they're actually sticking the gauze in to help stop it. Compress packing. You have your arms, like we say, you have your legs, you have your neck, armpits, groins, and body. And again, just a quick review of that. Notice your extremities, your groin, armpits, neck, and then you have the body itself. When it comes to compress, if the direct pressure is not going to work, and also we're knowing that the packing of the wound is not going to work, a tourniquet will work. But when it comes to the tourniquet, it is only going to work on extremities. Again, when doing this, you need to apply this tourniquet 2 to 3 inches above the wound, not below the wound, but 2 to 3 inches above the wound. Do not place over elbow or knee. These are hinge joints. So once they bend, that tourniquet will slide off. So you want to place it 2 to 3 inches above the wound. Tighten the tourniquet until bleeding stops. Now, one thing they're going to complain about is, ow, it's too tight. If they're complaining and they can feel they're living, that's good. You want to tighten that tourniquet until it truly stops. So you have to let them know, hey, so-and-so, this is going to hurt, but I'd rather hurt than you die. And then you're going to tighten it up. They will thank you later. They may cuss you out at the beginning, but they will thank you later. And also, do not remove that tourniquet. Once you apply that tourniquet, do not remove that tourniquet. One thing you need to know is, yes, can apply to others on yourself. So you can apply it to yourself, you can apply it to others. For the hands-on, you're going to learn how to apply it on yourself and how you're going to apply it on your partner as well. Can be applied over clothes, but you want to try to expose it. But you can be applied over clothes. Tourniquets will hurt, like stated before. They get over it. But your objective is to stop that bleeding. A second tourniquet may be required to stop the bleeding. So if that first one's not stopping it, that second one will stop it. 2 to 3 minutes, 10 minutes, something of that nature. That is not true. So again, that is definitely not true. Your tourniquet can actually stay on a lot longer than that, and there has been documentation so that a tourniquet can stay on longer than that. These are your different types of tourniquets. You have your soft TT, you have your CAT, which is what we're most familiar with. You have your SAM, XT, RMT, TX3, and TMT. Bleeding control in children, and all but the extremely young child, because we went over puberty when we talked about CPR as well, and all but the extremely young children, the same tourniquet can be used for the adult as well as the child. For the infant or very small child, the tourniquet is going to be too big. So direct pressure is truly going to work. People are like, well, I'm going to use my belt or something of that nature. It has been proven those homemade or bootleg tourniquets are only 20% effective. So if the child is too small, direct pressure. Because again, it's a smaller area, direct pressure will work. For large, deep wounds, wound packing can be performed in children just as it is in adults with the same correct technique. Facts and questions, impaled objects, improvised tourniquets, loss of arm or leg pain, or other questions. If there's an impaled object, keep that object in. You want to bandage around that object, because what's happening is once that object is actually impaled inside, the body is now actually doing coagulation or trying to heal itself. So when it's inside, keep it inside, because once you remove it, you will have significant bleeding. So you don't want to stop that. You also have your impromptu tourniquets as well, which we're going to talk about later. Loss of arm or leg. If there's a loss of arm or leg, you can still apply the tourniquet again, 2 to 3 inches above, stops the bleeding. Pain. Yes, there is going to be pain. It's a tourniquet. It's going to be pain. So a summary: call 911. Scene safe. Letter B, find the bleeding. Where's that bleeding? There's clothing. If there's clothing, remove the clothing so you can see where it is. You have to expose. Modesty is out the window. C, compression. So again, compression. Direct pressure is what we're talking about. If it's a large wound, then you're talking about wound packing. And if there's bleeding, not just venous, but actual arterial bleeding or squirting, then you want to apply a tourniquet. So again, be mindful of when to apply that tourniquet. And lastly, once you start, you must wait for help. Don't apply a tourniquet and just roll out. And stop the bleed. The only thing more traumatic than or tragic than a death is a death that could have been prevented. So you can prevent that death. Be mindful of that.
This is Kane 1906 with Whiteside Tactical Solutions. If you have any medical topics you want us to cover, please let us know. Feel free to send us an email at info@whitesidetacticalsolution.com. That's info@whitesidetacticalsolution.com. Hope to hear from you soon.